My name is Jay Donecker, and during the past 5 years in my role as Chief Veterinary Officer for Exuviant Therapeutics, I've been working with clinical researchers conducting client-owned dog studies necessary to bring Synovetin OA to the veterinary device market. With this short PowerPoint presentation, I would like to describe these studies and the results, which establish not only the safety, but also the effectiveness of Synovetin OA in the clinical setting when used to treat dogs with elbow osteoarthritis. When a joint, such as the elbow joint of the dog, develops osteoarthritis, or commonly called OA, a vicious cycle occurs. This cycle is often initiated by an instability caused by elbow dysplasia, with the immediate effect of causing an inflammation of the synovial lining called synovitis. It is interesting that many orthopedists in the past have downplayed the role that synovitis plays in this cycle, but research during the past 10 years has determined how significant of a role synovitis plays. As this cycle continues, other causes of inflammation, such as cytokines and pro-inflammatory mediators, also occur, worsening the synovitis and the pain associated with it. The continual cartilage degradation also contributes to the joint instability, and round we go. Initially, studies were conducted to determine the mode of action and safe use of tin 117M colloid to treat accepted lab rat models for OA. Following these studies, a 5-colony bred dog study was conducted to determine a histologically substantiated safe dose of tin 117M colloid to use in dogs. These results of this study have been published by Dr. Jimmy Latimer and others in the peer-reviewed journal Veterinary Radiology and Ultrasound in August 2019. The following initial study in client-owned dogs had several objectives. First, to determine a safe and effective dose to treat mild or moderate elbow OA. Second, to determine that the use of tin 117M colloid was safe to treat canine elbow OA in the clinical setting. The elbow OA grading used was established by the International Elbow Working Dog Group. There were 34 dogs in the per protocol population, in which each had one elbow treated with tin 117M colloid. Enrolled dogs were randomly assigned one of 3 dosages at either the University of Missouri College of Veterinary Medicine Hospital, the Louisiana State University School of Veterinary Medicine Hospital, or at Gulf Coast Veterinary Specialists in Houston, Texas. Samples for CBC, blood chemistry, urinalysis, and joint fluid analysis were obtained for baseline values and for 1, 3, 6, 9, and 12-month time point values. Radiographs, CD, and MR images were also obtained at these same time points. Forceplate data was collected at 2 of the clinical sites, LSU and Gulf Coast Veterinary Specialists. Overall treatment success was 88%, 30 of 34, as well as 88%, 18 of 22 were also found to be successful, based solely on forceplate evaluation. A dog was considered successful for forceplate evaluation if the peak vertical force or the mean vertical impulse was improved by at least 5% greater than baseline values at a subsequent time point. This is Resner with his owners. He was successfully treated as part of this initial study. The Canine Brief Pain Inventory is a validated client survey in which the duration of the effects of the intra-articular treatment can be tracked by clients of dogs treated by completing the CBPI at specific time points. For this study, this survey was completed at baseline, 1, 3, 6, 9, and 12 months post-treatment. This bar chart shows in dark blue the CBPI survey results if the conventional definition of success is used, namely that the pain severity score improved by 1 whole integer and the pain interference scores improved by 2 whole integers, and are both improved when compared to baseline values for each dog. What is depicted is that most dogs treated with the label dose of this group were determined to be successful at 9 months. The green bars are those patients receiving the labeled dose of Synovetin OA in which either the pain severity score or the pain interference score was successfully improved, while the other score was the same or better than the baseline score. Here too, the same progression is seen, in which the most dogs in the label dose treated group occurred at 9 months following a single intra-articular injection. This bar chart is of 22 dogs enrolled at LSU and at Gulf Coast veterinary specialists, both of which had a Forceplate laboratory. The University of Missouri did not have a Forceplate laboratory at this time. What is illustrated is that the Forceplate results mirrored the same progression, in which the most dogs showing Forceplate success was at 9 months. Forceplate success was defined as an improvement of greater than or equal to 5% in either peak vertical force and or mean vertical impulse of the treated leg when compared to its baseline data. The same trend was also seen by clinicians conducting lameness exams at each of these time points too. The next client-owned dog study we conducted was to treat dogs with a more severe form of elbow arthritis, in which the International Elbow Working Dog Group grading was used. Only arthritic elbow joints were treated. Therefore, only 25 elbows were treated of the 14 dogs. 3 elbows were normal with no pain and therefore were not indicated to be treated. These grade 3 dogs had a more severe form of OA, and as you would expect, the overall success rate was less than the previous study with mild or moderate OA. The success rate for this study, in which grade 3 elbow OA was treated, was 71%. This study was conducted at 2 sites, the LSU School of Veterinary Medicine Hospital and at Gulf Coast Veterinary Specialists in Houston. The subsequent flooding in Houston damaged beyond repair the Forceplate data for the Gulf Coast dogs. Therefore, the success for all these study dogs was based on only the CBPI and the clinician's lameness exams at both sites. During this 12-month study, mean reductions of lameness scores were seen at all points except at the 12-month visit when compared to the initial baseline scoring. Jonah, pictured here, was part of the grade 3 study. Our third client-owned 12-month long study was to answer the question, is it safe to re-inject a joint that had previously been treated with Synovetin OA? The answer is yes, it is. A patient should not be considered for retreatment until at least 12 months have elapsed from the previous treatment. As would be expected, there was a lesser success rate in this small group of dogs for the progressive elbow OA condition. Success was determined by a composite of client CBPI, clinician, and Forceplate results, with Forceplate results taking precedence when there were conflicting results when compared to baseline results. When the CBPI success is tracked in the 3 client-owned 12-month dog studies and illustrated by a bar chart of the time point successes, you can see that here again, the 9-month time point is when the most of the label treated group were scored to be successful. Here again, the dark blue bars are the CBPI conventional definition successes, and the green bars are the CBPI successes based on either the pain severity score or the pain interference score was successful, with the other one the same or better than baseline values. These dogs were seen to be improved as compared to the initial baseline survey results by their owners. Prior to conducting any client-owned clinical investigations, laboratory rat studies were completed to determine whether it was histologically safe for joints to be injected with tin 117M colloid and also the mode of action of the colloid. From these studies, a 5-colony bred dog safety study was conducted. Here too, histologic examination of treated elbows, along with radiation excretion post-treatment, were determined. The 5-dog study was published in August 2019 in the peer-reviewed journal Veterinary Radiology and Ultrasound by Dr. Latimer and others. The 3 client-owned studies conducted after the 5-dog study tracked several data points to determine safety of the use of tin 117M colloid to inject intra-articularly into a dog's arthritic elbows. There were no treatment-related safety effects, either locally or systemically, following treatment using tin 117M colloid. A total of 69 dogs and 97 elbows were injected to make this determination. This was expected, as the reported adverse events reported in people when using similar radioisotopes is 13 per 100,000 human patients treated. Synovetin OA is retained in an injected elbow for at least 90 days, during which radiation therapy is occurring and reducing synovitis. By this time, over 98% of the therapeutic radiation has been applied to the synovium locally. This explains why adverse systemic effects have not been identified, and why concomitant systemic co-therapy can occur as part of a multimodal approach at treating the pain associated with chronic elbow OA. Eventually, Synovetin OA will decay to microparticles of inert tin that are transported through the lymphatics to lymph nodes draining the elbow joint, and eventually via lymphatics to the liver. With appropriate go-home instructions based on the radiation emitted by the specific dog, there is a low exposure to the caretakers at home. The largest dogs receiving the largest doses with proper adherence to go-home instructions will expose the home caretakers less than 1/2 of the radiation a person would receive if a CT of one's head were needed. This is not a negligible amount of radiation, but to treat a beloved canine member of our family to be in less pain due to chronic OA, these guidances have been found to be a minor accommodation. Thank you for listening and attending this synopsis of these Synovetin OA canine clinical studies. Here are the 2 references referred to on slide 9. This is the first page of the Synovetin OA package insert. If you would like a copy, please go to our website, www.synovetin.com, and one can be downloaded. This is the second page of the Synovetin OA package insert. Thanks again for attending this webinar in its entirety.